The deadly Wuhan coronavirus, officially called 2019 nCoV, has killed 17 people and infected at least 554 others in China as of Wednesday. The U.S. confirmed its first case, a man in his 30s in Washington state who had visited China, on Tuesday. Scientists are still scrambling to fully understand the virus, which they confirmed this week could be passed from human to human. The Centers for Disease Control and Prevention (CDC) has released guidance for healthcare professionals on the symptoms of the virus. What to look out for? According to the CDC, a person could be at risk if they have fever and symptoms of lower respiratory illness, such as coughing or difficulty breathing, after traveling to Wuhan or having close contact with someone who was ill and is now under investigation for the virus in the past 2 weeks. Fever or symptoms of lower respiratory illness after having close contact in the past 2 weeks with someone who's been confirmed to have the virus. The CDC defined close contact as being within about 6 feet 1.8 meters or within the room or care area of a person with the coronavirus for a prolonged period without appropriate protective clothing, or having direct contact with infectious secretions of a person with the virus without protective clothing. The agency said close contact could include caring for, living with, visiting, or sharing a health care waiting for area or room with a person with the virus. The CDC said that if you have traveled to Wuhan recently and feel any of these symptoms, you should seek medical care right away. Call ahead to tell your doctor about your travel and symptoms and avoid contact with other people. People in the U.S. who meet these criteria should be evaluated for the virus and their case reported to their state health department. It added, who is at most risk? Coronaviruses like 2019 nCoV are particularly dangerous for people who have weaker immune systems, like young children and older adults. There are no vaccines to protect people from contracting a coronavirus. Pets are also at risk of catching coronaviruses, which can lead to disease and even death. The source of the Wuhan virus outbreak was identified as a market that sold seafood and live animals like wolves and civet cats.